everyone, welcome back to Psychotherapy, Education, and Training. I'm Dr. Steve Johnson, and today we're covering a topic that's not real flashy, but absolutely essential: how to write notes, diagnoses, and treatment plans that meet insurance standards and protect you in the event of an audit. If you're a graduate student, new therapist, or even someone who's been in practice for a while, but still dreads documentation, you're not alone. Most of us were trained in theory, not paperwork. In this video, I'll walk you through how to write SOAP notes, structure treatment plans, and justify medical necessity, all in a clear, simple, and practical way. And yes, we'll look at some common mistakes too, but how to fix them. Let's start with the backbone of good documentation, your SOAP notes. It stands for subjective, objective, assessment, and plan. If you follow this structure well, you're already 80% of the way to a defensible progress note. S, subjective. The S stands for what the subject tells you, their internal experience. This can be in quotes or paraphrased emotional content. You want to focus on what the client is experiencing and how long it's been going on. For example, instead of just writing "client is depressed," write something like "client reports feeling hopeless and worthless every day for the past week. They said, I'm just going through the motions at this point." That gives you a time-based symptoms and direct emotional content, which is what the insurance reviewers look for. A common mistake here is being vague or too short. Writing just "client reports doing okay" tells us nothing about symptoms, emotion, or impairment. O, objective. Now we move to O, objective. This is what you observe. Think behavior, appearance, affect, speech patterns. Let's say your client is anxious. Instead of guessing or labeling, describe what you see. For example, client appeared restless, shifted in their seat often, and had trouble maintaining eye contact. Speech was pressured. What we're doing here is painting a clinical picture, not writing a novel. A mistake I see often is writing something too general, like "client was tired." Instead, make it specific and observable. For example, client appeared fatigued, had dark circles under their eyes, and rubbed their forehead several times while speaking. A, assessment. Next is A, the assessment. This is your clinical interpretation of everything you've gathered. You might be noting progress, stagnation, or worsening symptoms. For example, client continues to present with symptoms of generalized anxiety disorder. Frequency of worry has decreased, but muscle tension and sleep issues persist. It's tempting here to write something like "client is doing better," but what does that mean? Better in what way? How does it relate to their diagnosis or treatment plan? Always be specific. P, plan. And finally, P is your plan. This is what you did in the session and what comes next. Think interventions, homework, future focus, or referrals. For example, practice challenging cognitive distortion using REBT framework. Assign the ABC worksheet. We'll continue focus on thought monitoring and introduce shame-attacking exercises next week. A common mistake is just writing "continue therapy." Well, yeah, but how and why? Always connect the plan to what the client needs next. All right, so we've covered notes, but SOAP notes should always align with your treatment plan. This is another area where therapists either go too vague or too complicated. A solid treatment plan has 5 pieces: the diagnosis, the goal, the objectives, the interventions, and the review timeline. Diagnosis. Let's say your client has generalized anxiety. You list F41.1, generalized anxiety disorder. Goal. Then write a long-term goal. For example, reduce anxiety symptoms and improve ability to function at work in relationships. Objective. Objectives are where we get specific. They should be measurable. For example, client will use cognitive restructuring techniques to reduce daily worry episodes from 5 times per day to 1 to 2 times per day within 6 weeks. Avoid objectives like client will improve self-esteem. That's not measurable. How will we know when they've reached it? Intervention. Here's where you tie in your modality. What will you do? Example, use CBT and REBT interventions focused on identifying and disputing irrational beliefs related to threat overestimation. Timeline for review. Finally, note when you'll revisit the plan. 90 days is standard. You can write, treatment plan will be reviewed and updated every 90 days or as clinically indicated. Now, let's talk about the big one, medical necessity. This is what insurance companies really care about and what protects your notes in an audit. Medical necessity just means that therapy is being used to treat a mental health condition that causes functional impairment and that the treatment is clinically appropriate. So when you're writing, make sure to show there's a covered diagnosis. The client has symptoms that interfere with functioning. You're using evidence-based treatment, and there's measurable progress or ongoing need. Here's an example of a medical necessity statement. Client meets criteria for major depressive disorder. Symptoms include sleep disturbance, low motivation, and guilt impair work performance and self-care. Weekly CBT and REBT are medically necessary to reduce symptoms and restore functioning. What you don't want to do is say, client has anxiety, doing therapy weekly. That tells us nothing about severity, impact, or why your services are even essential. Let's quickly run through a documentation habits that can get therapists in trouble and how to avoid them. Copying and pasting notes across session. That's a big red flag. Being too vague, like client is doing well or therapy continues. Not linking your interventions to symptoms or the treatment plan. And lastly, forgetting to note risk, medication changes, or client non-compliance when that's relevant. If it's not in the note, it didn't happen, at least not from a legal or audit perspective. Here's the good news. You don't have to be perfect. You just have to be clear, consistent, and connected to your clinical reasoning. You already have the knowledge. You got that at the university. This is just learning how to communicate it on paper or digitally in a way that protects your clients and protects you. If you found this helpful, check out the free download linked in the description. It's a SOAP note and treatment plan template that includes examples and reminders. And make sure you subscribe for more practical content that bridges the gap between theory and the real world of clinical practice. If you want access to even more exclusive, in-depth information and training, become a member of this YouTube channel. Just click the join button and follow the directions. Thanks so much for being here, and keep showing up for your clients and for your own development. You've got this. Have a great day.